Thanks for the thumbs up. I appreciate that. Hi, good evening. Thank you very much for taking some time out to spend little less than an hour, may not have to go an hour, but spend some time with me in hearing some information that I hope you'll find useful this evening. As Jamie said, I am a pharmacist, and I've been a pharmacist for more than 30 years. And I primarily have worked as a pharmacist in the hospital setting. So if you've ever been hospitalized or know someone who's been hospitalized, I would have been one of those pharmacists who uh, have been there behind the scenes in making sure you get the best and safest medication regimen. It's a little bit more complex than the pharmacists that you may be familiar with out in the community, like in a Publix or CVS or Walgreens. And so my area of specialization is in the hospital practice, just as you have some physicians who specialize in primary care or in the hospital. But one of our key tenets as pharmacists, no matter our setting, be it in the clinics or in the hospitals, is that, you know, you are taking medicine and that it is safe for you. And how is the medication performing in your body, and what can you expect from the medication? So after working for so many years and working directly, I also get to interact with patients as well. I have worked for 10 years also in a community setting. I've observed some things and had some encounters with some patients, because once you have to take medication and see a doctor or practitioner, you are a patient, right? I've encountered some things with some patients who aren't really clear about the medication that was given to them or prescribed to them, or even medicine that they see over the counter in the store that they can buy themselves without a prescription. Weren't really clear on some things, and could use a little help with understanding how to go ahead and approach the regimen and how to manage it so that they can have the best outcome. But what I'd like to first do is just to clarify my objective is not to provide one-on-one counseling. So like if you have some personal questions about your own medication regimen, I don't want to discuss that because, we are being recorded, it'll be shared, that would be your personal information. So it wouldn't be the most appropriate thing for me to do. But we may be able to arrange something later if you communicated through card, if you had some questions one-on-one through Jamie or your clinician. And so what I would like to do is go through a few slides that are general, that you can apply anywhere you go. What should I know? What should I do? What should I ask? And pose those questions to whosoever is prescribing medicine for you, or if you decide to buy something over the counter independently, right? If you had a cold or a body ache, you may stop off in the store and say, I'm not feeling so well. I don't need a prescription. I'd like to pick up some Tylenol. What should I do? So that it can be a positive experience and not something that is unpleasant, and you get the best outcome for what you're seeking through that medication, and also to prevent any mishaps that could occur. So I hope you got that part. Is that okay, ladies? Thank you, Shan. Thank you. All right, very good. All right. So we'll go through a few slides, and if you need me to stop or clarify anything, just go ahead and you can communicate that through Jamie, or you can unmute, we can speak, you can speak it audibly. Okay. Beautiful. All right. So as I said before, I'm hoping that after we meet here today, that you'll be able to just recall some helpful questions to ask practitioners. I want you to be able to take an active part, an active role in your office visits with your doctor, your dentist, your nurse practitioner, and not just be present, but participate and ask some questions and have those questions ready before your visit. We'll also look at some over-the-counter products, some real examples. You know, when you go in the store, you don't need a prescription, things that you can just grab yourself, some Tylenol or some naproxen or some antacid or something for stomach upset. Then also, I'd like for you to be able to describe, how do I keep track of this medicine that I'm taking? Did I take it in the morning? Did I take it at night? Did I miss a dose? How do I keep track of that? And then also, why is it important? Hopefully at the end, you'll have a greater understanding of why it's important to make sure you take the medicine the way it's prescribed or intended. Before we get into this slide about questions to ask the prescriber, I'm gonna say that we all wake up each day and we have plans. Some of us, we wake up and we plan to walk our dog, watch our favorite video, do something recreational. But did either of you wake up today and say, hey, you know what, I think I'd like to get sick today? Right, no one wakes up and says, I think I want to get sick today. But then what happens, right? You may wake up not feeling that great, and you have to see someone, you have to see a medical professional for that. So then after you see them, they come up with a plan for you, a medical plan, and sometimes that plan requires medication. You didn't plan that, but now all these demands are placed on you. So I want you to know that if you ever do have an illness, you see someone, they may prescribe medication, and so you'll be prepared no matter who you see, be it a doctor, a dentist, or anyone, in knowing what questions to ask about medication if they prescribe something for you. Have either of you ever had to take medicine ever in your life? Okay, all right, yes, right? Even if you were 2 years old, 3 years old, 4 years old, up until this age, right? We've all had to take some form of medicine. So now you're gonna be a little wiser and a little smarter on what should you ask. So on this slide, it says questions to ask the prescriber. And in green, I put prescriber because a prescriber could be a nurse practitioner, a doctor, right? A physician assistant. They can prescribe medications for you. So I won't just say doctor sometimes, or even a dentist, but you want to ask them, what is the purpose of the medication? You see that in bold? What is it supposed to do? What precautions should you take? Is there anything that I should look out for? Should I not, go outside and ride my scooter if after taking this medication, or any motorized vehicle? Are there any side effects? People have heard side effects. And if there are side effects, how do I manage them? And then, okay, if I do experience a side effect, which one should I report to you? Because some are major, some are mild, and you should know this. And remember, you want to have these questions, and these slides will be made available to you, so you don't have to try to remember, but then at least you'll put in your device or in your notepad or have it on paper, these key questions to ask if they prescribe medication to you. Then you'll also want to know, how will I know the medicine's working? Is there any lab work that I should do? Like, let's say you're taking some medication for high blood sugar. Is there some lab work I should do at home? Or do I need to go to a lab and have some lab work done? Or how long will it take for me to see the benefit from this medication. Now, I'm switching gears a little bit on this last bullet about creams and ointments. If a doctor and you go in and have you ever had a rash or a bug bite or anything like that? Right. And sometimes it requires a special cream or a special ointment. Well, many times I've seen people, the doctor has prescribed the cream or the ointment, and then they go to the pharmacy, they pick it up and it says apply to affected area. Well, how do you know what area it is? Which area was affected? You want to know before you leave your doctor's office, where should I apply? Should I apply this cream or this ointment on my leg, my knee, my back, my arm, and that sort of thing? And just remember that all creams and ointments are not the same for the same condition. So let's say you had a rash on your leg and it was red back in January, right? Because you went outside and you maybe got into some sort of bushes or something and you prescribed a cream and it worked for that. Well, then now you're in the summer and you have another rash. It's no longer on your leg, it's on your upper arm or something. Do you think it would be okay to use the cream that you used in January, now in June, for your arm? You used to use it for your leg? Right. So you don't want to assume. You want to, if it's a new rash or a new condition, you want to make sure you have that looked at and make sure by the doctor see if it can be used for this area, because it may not be the same.
Daisy, we have a comment in the chat saying, I had a heat rash once. It was not fun. I was prescribed cream and it went away.
Right. Now, was the cream specifically for the heat rash?
If I recall correctly, it was just a cream that my PCP prescribed to me through the pharmacy at where I work. I don't recall the exact details because this was a long time ago, but all I know was that the cream helped get rid of my heat rash. When I was doing carts at work, the heat rash would get very bad.
Mm-hmm. So yes, so you just want to make sure if whatever that cream was, if the doctor prescribed the first time for heat rash, then find out, okay, if I have heat rash again, is it okay for the same heat rash? Because all rashes are not the same. Okay, very good. Thanks for sharing that. Now, yes, there are questions that you would ask the prescriber or your PCP or your doctor or your specialist, but there are also some questions that you can ask the pharmacist. Now, the pharmacist, I'm going to say this because things are different now. You know, some people, they fill their prescriptions locally in the pharmacy at Publix or Walmart or Walgreens or CVS, and then you have to receive your medication sometimes through the mail with mail order. You know, they mail it to you. I'll ask the question, Sean, do you have to receive medicines through the mail or?
As a matter of fact, yes, actually, we did that with an iron supplement that I used to take.
Mm-hmm. Okay, yes, because sometimes it depends on the insurance, but some insurances will require for you to receive it through the mail. But either way, you're still able to talk to a pharmacist. So for example, what I'm saying is, let's say you receive your medicine in the mail, but you have a question and you can't quite get through to the phone number on your package, on your prescription to talk to the pharmacist through mail order. You could still go into the local pharmacy and ask the pharmacist questions. Publix is a little less busy than CVS and Walgreens and Walmart. So you may be able to ask a quick question and you don't even have to be one of their patients or their clients. You can just ask a general question, pose it to them. But questions that you should ask the pharmacist, you can ask the same questions. What side effects are to be expected? Because pharmacists are supposed to be the medication, more knowledgeable about the medications. And they have greater databases to do searches for you. to answer questions regarding medications and their profiles. Another question you want to ask the pharmacist is drug interactions. Will this medication interact with something else that I'm taking? Let's say you're already at home and you're taking iron. You mentioned iron once a day. And now you went to the doctor and the doctor says, well, now I want you to take this antibiotic because you've got a little chest cold, viral cold or, something going on. And I want you, or sinusitis or something, and I need you to take an antibiotic to clear up the sinusitis, sinus infection. So now you have two medicines. You've got an antibiotic and you've got iron. So then you may want to wonder, are these going to interact with each other? Is it safe to take the two now? So that's a question that you can ask. You can ask your doctor, but you can also ask the pharmacist. And so you may ask, can I take it at the same time? Oh, okay, question. Did you have a question?
I have my hand raised because there are apps like if you have an iPhone, there's a health app on your phone, and if you put in what medications you take, it'll tell you what the interactions are and if they are mild, moderate, or severe.
Oh, that's very resourceful. And yes, you are right. There are many apps available. And what's important is to use those apps. Yeah. And some folks don't access them and use them. So by using those apps, that is very wise to use them. And just be careful and make sure that it's a reputable app. I'm not sure that the
Don't
name
worry, it's just the don't worry, it's just the official health app that Apple makes. It's not one of those bogus apps
Good.
or anything like
Right.
that.
Right. And so, yes, so you do want a reputable app. Also, does it mention drug interactions with certain foods or drinks as well? Do you know?
I'll have to go ahead and check that. I'm checking it right now, and
Okay.
it only says like alcohol and cannabis on the app that I take.
Okay. And that's medication specific because it may mention alcohol or cannabis because some things that medications that work in the brain, alcohol and cannabis also work in the brain. So it may be specific to mentioning those things. But there are some medications that interact with certain common foods that we consume or drinks, and you may need to space them apart by a couple of hours, or you may need to avoid them altogether. Grapefruit juice is one in particular that interacts with many drugs, many medications. And so I don't know many people who like grapefruit juice like they used to, but they have found that grapefruit juice does interact with many medications, and that's something to be cautious about. And also, should I take the medication with food or without food, with or without meals? A lot of your labels on your bottles, your prescription bottles, will mention these things of, take with food or milk for you. But these are questions you can ask as well, in addition, to be extra sure. And then, how should I store the medication? So I'll give you a funny story. We're talking about taking the medication with or without food. When I was a teenager, I was given a prescription, and on the label it said take with food. Well, I took that literally, and I swallowed the tablet with food instead of water. Didn't quite understand what it meant to take with food. And when they say things like take with food, they're actually trying to say, go ahead and have a meal and then follow with the tablet. So I found it very hard to try and swallow a slice of bread and a tablet, but somehow I was able to do that. But then later on, as I matured and went to pharmacy school, I realized that wasn't the smartest thing to do. So if you see a label that says take with food, they're trying to say have a meal and then go ahead and take your tablet or your medication. So I just wanted to share that with you. How should I store the medication? Should it be refrigerated or not refrigerated? Then you should also share with everybody your allergy history. If you're allergic to anything, let them know, if I take certain medication like ibuprofen, it gives me my throat swells. That's an example of a true allergy. But an intolerance and a sensitivity isn't really an allergy. So for example, if you take a certain medication and you felt slightly nauseous after taking it, that's not really a true allergy. You would just intolerant or sensitive. And so that is something that you should clarify with your prescriber. And that is why we need to know the type of reaction and the description of the reaction. And always share with anyone, even if you're going to have like a small surgery or procedure, your allergies or your medication history. Even if you're going to have like a dental extraction, something as simple as that, let them know you take medication and what it is. Because some medications you have to stop taking for a few days before you have the procedure or before you have surgery. Does that sound fair?
Daisy, we have a question in the chat in regards to the previous statement. Does lemonade have a similar effect as grapefruit juice because they're both in the citrus family?
Oh, very good question. Lemonade does not. So it's just something about grapefruit and its components and its makeup that is the bigger problem, but we have not found drug interactions reported with lemonade. That's a very good question. Okay, so now I've got a few devices here on the screen. Have either of you seen these devices before?
I have.
Okay, which one are you familiar with, Sean?
The one I'm familiar with is the one that is at the bottom, the little blood pressure thingy. My mom has one of those.
All right, okay, super.
Is,
Sienna?
is my mic working?
Yes.
Okay, so this one on the top left is a these like the blood thingy, the blood check thingy they have at like the phlebotomist or at like the blood or at the doctor. I forgot what it's called. So what they do is that they just like pinch your finger with this thing, with this needle, and they have like this button at the top and they just press it and check your blood level. If it's over 200, it's bad. It has to be 120 or 130 or lower to see if your blood is good. Blood glucose monitor.
Blood glucose, very good. Thank you both for sharing, and I appreciate how observant you are of these devices, because these are little small devices, yes, that you can have in your home. 40 years ago, 50 years ago, they weren't as popular in our homes, but they are very popular now in our homes and very accessible. You can go anywhere, pretty much to any store on Amazon or anywhere, and purchase these without a prescription, or some folks, your insurance may pay for them. Especially, they can be a little pricey for some folks. So if your insurance will pay for them, then you can ask. But if you're ever prescribed any medication, we go back to one of the slides where it said, how will I know if the medicine is effective? Well, if you take a blood pressure medication, you shouldn't wait until 3 months, 6 months for your follow-up visit with the doctor. It would be best to take your blood pressure each day before you take your medication to see if it's working. And then you should know what number is too high for blood pressure. Find that out from your prescriber. Is 100 too high? Just like you mentioned, Sienna, if it's above 200, my blood glucose, that is, then that's not good. Your pulse, that means how fast, your heart is beating. That is also on the blood pressure machine. And so you should know that number as well. What limits? Ask your prescriber, your doctor. your nurse practitioner, your physician assistant. Your blood glucose, that's the upper left. What's a good number for my blood glucose? I'm taking medication for my diabetes, or I'm trying to prevent diabetes. You say I might be close and I don't want to take medication, then what's a good number? And then if the other one in the upper right with the red, yellow, and green is something for folks who have asthma. They can also monitor their lungs, how efficient their lungs are functioning on a daily basis with this type of device. And, you know, asthmatics have to take medications as well on a daily basis. Okay, the next slide has some pictures of a couple of supplies, I would say. And the reason I put this slide up is because I have met folks in the hospital who have been admitted only because they were prescribed a medication, but they had no way to actually take the medication. So what do I mean by that? The bottom graphic where it says Humalog, you know, the bottle there and the 2 pens, those are insulins. Those are insulin medications. Well, insulin has to be injected into the skin. Well, how do you inject into the skin? Well, you need a needle, a syringe with a needle, such as in the upper right corner, the orange one graphic, to deliver the insulin into the body. Well, the Humalog one right here, this is insulin, but there's no needle. You need this needle to access the insulin, and then you inject this into your skin. This particular insulin, there's insulin there, but you also need a small needle on the end to deliver it into your skin. I have seen patients who have been admitted into the hospital because they had just the insulin liquid, but no syringe needle, no supplies. So they needed a prescription and didn't have all the proper supplies. I've seen patients who had the pen, but no little needle on the end to inject it into their skin, right? So what good is if you have medication and you can't actually get it into your body? A tablet is easy, a capsule is easy. You just take it by mouth and you swallow it. But if it's something that has to be injected, then you know you're gonna need the proper supplies. And then this particular machine is, some people call it a breathing machine, but it's a nebulizer. For folks who have difficulty breathing, it could be short-term or long-term. Have you ever seen one of these before, Sean? Oh, good.
I have, when I'm at work, I've sometimes seen customers that have those. Aren't those called CPAPs?
Well, a CPAP is a little different. This one, it actually, if you look right here, this is where their mouth, this is an attachment where their mouth would connect to, but right down in here is where medication would be placed, and the medication will help open up their lungs to help them
That's
breathe
pretty
better.
interesting. I didn't know that.
And so some patients have to use it once a day, twice a day, or more than one, you know, twice a day, depends, right? There's some folks who have chronic bronchitis or emphysema or asthma or just bronchitis for an illness, a short-term illness. And so the medication that has to go in this small compartment, and then your mouth goes here and you, and just like a little vapor, and you just inhale, you know, slowly to help open up the lungs. Well, this is another important piece of equipment that you need. I've seen patients who have the medication, but not the equipment to deliver the medication. So if it's something that's new to you, this is another important question to ask. Are there any supplies that I need to go along with it? Okay, because patients have been readmitted into the hospital simply because they didn't have this machine or this needle to deliver the medication. All right. We're going to get into something I hope is a little fun. I hope you'll find interesting. This is a graphic of a bottle. OTC literacy is the title. OTC stands for O, over, T, the, C, counter, over the counter medication. What do I mean by over the counter medication? That means that this is a medication you do not need a prescription for. You can just walk into the store and purchase it yourself without a physician writing a formal prescription for you. So you'll hear the term OTC, or over-the-counter medication, used. It's because you can walk into Walmart, Publix, CVS, any of your favorite stores in the pharmacy section, take the product off the shelf yourself and purchase it for whatever condition you're experiencing at the time. Well, why did I insert this segment? It's because those labels can be very confusing. I went to pharmacy school, and sometimes I pick up the product and I'm confused even. So we're gonna go through some pieces of the label so that you'll understand how to read the label and understand what the label is actually saying to you. Have either of you ever had to purchase medicine over the counter for any condition? Okay, all right. So this is an actual over the counter or OTC label of Mucinex. Cough and cold season, when it arises, it's a very popular over the counter product. Have you ever seen that little green blob on TV or I don't know, right? Yeah, this is his product. This is what he promotes, right? The mucus guy, right, in your chest. And so Mucinex, this is something that I saw in our local store. It's a very busy label, but we're going to go through it bit by bit, okay? First, look at this label. You have here drug facts and active ingredient. Your active ingredient is here, and we'll talk about what the active ingredient is. Then uses, right? Then you have a section called warnings, and I'll go back over and explain what each of those mean. Then you'll have a section with some additional facts if they ran out of space on the label. Then you have a section with directions and even some age limits. In this section, how to store the medication. And then in this section, inactive ingredients. Now, the label is regulated by the Food and Drug Administration in that it has to have all of this information on it. Now, the graphics and the presentation, how it looks, isn't regulated, but the key information has to remain the same with every over-the-counter product. So when you look at the active ingredients, you want to know what is actually contained in this Mucinex product. What is the cure? What is the name of it? And the active ingredient is what the cure is. So you want to look at that. And then the purpose, right? We said we want to know what's the purpose of the medication. That's one of our key questions. Right here is your purpose, use. This is used to break up phlegm and mucus, right? Then some warnings, some cautions, some side effects, things that I need to look out for is in here. One of their main warnings is not to use it in someone who's less than 12. Directions, how do I take this? It's got a lot of bullets here, and it doesn't get into the real instructions until you get about the 4th bullet of every 12 hours, but there is some other key information in here. Then how do I store it? And then the inactive ingredients. And then if you have any questions, you can always try and reach out to the company. Let's further look at this label and compare. Directions. directions are here, and they're telling you what to do, what not to do, and how, oops, I'm sorry. I apologize. What to do and what not to do, and how often to take it. And in particular, some age limits on this product. Okay. And now we're going to look at the label again further and notice the active ingredient compared to the inactive ingredient. The active ingredient is what will cure your ailment, okay? Not to be confused down here with the inactive ingredient that doesn't cure you. The inactive ingredient just lists things like preservatives or colors. You know, some people are allergic to red dye and things like that, so they do list that. But just, I don't want you to ever be confused with the active ingredient and the inactive ingredient. Active ingredient is what will cure me. And the active ingredient is also, it will also list the generic name of the product if the product is a brand name product. Mucinex is a brand name product. The patented name of the product, the trademark name. And then this small letter G, guaifenesin, is the generic name. And we'll talk more about brand and generics in a minute. Okay. We want to try and play a quick game, a little Jeopardy game. OTC, you feel up to it, ladies? Yep, okay, all right, I'll try and get there. We'll try and get us there. Okay, so this is we'll just do a couple of questions. It's like Jeopardy, you know, it gives you the answer and you ask the question. And we won't do the whole entire board, but we'll click a couple and see if you can answer these correctly. So we have a few categories. We have, is something over the counter or is it considered prescription? Then the label we just looked at, the drug facts label. Next category is how to store the medication. And then the fourth category is understanding safe medicine use. Do you want to choose a category, Shawn?
Sure. Let's go for understanding safe medicine use for 100, Daisy.
All right, here we go. So the answer is, oh, I didn't tell you this one. This is bad. I'm remiss. This is good though. Let's say the number that you should call, the number to call if you think there has been a medicine mistake. So this is like poison. This is talking about poison. Poison helpline. Have you heard of the poison helpline?
Yes, I have.
Okay, so if you ever suspect that you've taken something accidentally, it doesn't have to be a major overdose. You know, 911 is a great number. We all know 911, but you know, sometimes you may have taken maybe 2 more pills or 3 more pills of something, or you forgot. You can call the National Poison Control Helpline. And they can give you information. There are toxicologists who can tell you, okay, this is safe. This is what you should do. You should drink milk or you should go see a doctor right away. You know, these sort of things. But they also have a website, poison.org, which is on one of my slides. But yes, poison, that's a national number, no matter where you are, that you can call. Sienna, would you like to choose a category? We'll do maybe 2 more.
Yes. OTC on prescription 100.
Okay, here we go. The answer is medicine that should only be used by the person for whom a doctor ordered it. Prescription or over the counter.
Medicine that should be used only by the practitioner? No
Prescription medicine.
prescription.
So, and really that's any medicine. Only, you shouldn't share any medicine. You should only take your medicine, don't take anyone else's medicine, and you shouldn't share your medicine. Okay. Let's try storage tools for 100. Is that okay? Okay, let's go back. I don't like that one. Here's one. A kitchen tool that you should never use to measure medicine. I'll reveal the question. What is a teaspoon or tablespoon?
I was about to say that.
Oh, all right. I'll applaud you either way. Yes, right.
I was gonna say like a can opener, but that sounds ridiculous.
It does.
So you want to use one of those little plastic dose cups, right? That says 5 ml, 10 ml, 20 ml. It usually comes with the medication, but never use your own spoon that you use to eat your cereal. And then we'll go with the drug facts label for one, since we left them out in the last one. This is where you should look on the label for the symptoms that the medicine treats. This is going to be the uses section. Okay. All right. I think I lost I gotta share my screen again.
It should be in the PowerPoint presentation at the bottom.
There we go. Thank you. Thank you, Jamie. Okay, so we've looked at some of these over-the-counter, right, products, and you see how the label should look. Now I want to show you something that can be a little confusing. Since you have the power to go to the store and pick your own medication, if you're not feeling well, always ask someone to help you. You know, a friend, a trustworthy friend, family member, to make a selection and help you read the label very carefully, because sometimes the graphics and the labeling is very appealing, but they can be confusing. And if there is a pharmacist nearby, stop by their counter and ask them if this is something that is safe or appropriate for me to take. This particular slide demonstrates how things can look very close and similar. Do you notice, what do you notice? I want to ask each of you, what do you notice about the one on the left, Sean?
It says it's for kids and it says dietary supplement.
Mm-hmm. And Sienna, what do you notice about the one on the right?
I would say two things. One are the colors or the lids, and two is the label design, because these things are different. So they need to have a distinctive color so it'll be easier for the customer to tell. But sometimes these ingredients on here, it could be a little bit harder to like track out for.
Exactly. So, they do look very similar, and it's easy for people to choose the wrong one. So the one on the right is not intended for children. It's only intended for adults. It could be very harmful to children. So this is why I want you to remember when you're choosing your products to always read very carefully those sections, and particularly, the age limit, and if it is for someone your age or not. And secondly, you could be taking something that's intended for a child and it wouldn't work for you, right? You're not a kid, so the one on the left would not be appropriate for you. So just be very careful with products that you are choosing on your own. Here's some more similarities that can be confusing to folks. Mucinex, we talked about the green blob guy, right? The little Mucinex guy. Mucinex, what do you notice? Can you tell me a difference between these two products?
One literally says it claims to be maximum strength.
Right. Now, that is true. Maximum strength, correct. And another thing that I do notice is that this is Mucinex alone, but over here you have Mucinex and then something in green here that says DM. Very subtle, but it makes a big difference. Why? Because they both relieve chest congestion, but this one, the DM, suppresses your cough. You keep coughing and coughing and coughing and coughing, and you won't stop coughing. The one on the left will stop the cough. The one on the right will not. It'll just relieve your congestion. So just be a real good sleuth, right? Detective when you're reading your labels. Brand versus generic. I see you smiling, Sean.
I smiled because I saw Publix there. I wonder
Oh.
if those photos were taken at a Publix.
They sure were, yes. They were taken out of Publix. Now, why did I bring up brand versus generic? Because the brand name is the trademark name, the patented name, which is Mucinex DM, and generic is so it's close to, like, we don't want to say the chemical name, but it has a very long name, right? With several syllables, guaifenesin and dextromethorphan, right? But this is that active ingredient we talked about that we mentioned earlier. Generics work just as good as brand names. Brand names is, that's the trade name that was assigned to the medication when it was first developed, but then the patent expired. And so now other companies have permission to create or generate this at a lesser expense. So it'll cost you a lot less money to purchase the generic, but it's just as effective. Many people think, well, brand, generic, I prefer the brand because the brand's the only thing that works, but for the most part, generics are just as effective. So you'll see things like guaifenesin, Robitussin is guaifenesin, Tylenol is acetaminophen, Aleve is naproxen, Motrin is ibuprofen. Those are just some examples. So the Mucinex DM, Publix named their product Mucus Relief DM, but it's still generic and it costs several dollars less than the brand name Mucinex. Those were over-the-counter labels. Here are prescription labels. This is an example of CVS and how their label may present. Different pharmacies have different presentations, but what I want you to know is just always examine your labels, read them, get familiar with them, know the name of your medicine, the directions, the time of day, and how you should take it. And then any special instructions. Should I shake well? Should I take it with food? Should, you know, that sort of thing. Any precautions. Knowing your label, knowing the name of your medicine is very important. Not just, I take the brown capsule. There are so many brown capsules out there in the market, no one will know what you're talking about. Know the specific name. If the name of your medication is Tylenol, know that, not the white tablet, because we have thousands of white tablets. Also know how many milligrams it is. Is it 500 milligrams or is it micrograms? You remember that math, from math, micrograms, okay, and grams? Medicines are expressed that way, so know that as well. And also pay attention to decimals because decimals matter. 2.5 is not the same as 25, right? So the dose, you know, 25 is much larger than 2.5. So you really want to know the full name. I take Tylenol 500 milligrams, mgs, 4 times a day, if you're sharing that information with anyone. And then if it's a combination product, 2 in 1, just like the Mucinex. That's a combination product, guaifenesin and dextromethorphan. That's important. So if you're reading your labels, you should also express the combination. Okay. I'm getting close on time, so I'm trying to hustle through. Medications belong to a class, what's known as a class, right? You had like first graders, second graders, seniors, juniors. Your medications also belong to what's known as a class. If you're ever reading your labels or your prescription labels, pay attention and know how it's spelled. Because if a new medication is added, you want to make sure that it's not overlapping and it's not the same. So always really examine all of your labels and making sure that you know the full name of your medicines. I wanted to share with you all some helpful websites. Again, the slides will be available through CARD. But Be MedWise, and these are non-biased, right? Neutral websites. BeMedWise.org, they have information. Poison.org has information. And it's in simple, easy to understand language. Drugs.com is a nice website. You can check for interactions there as well. I know Shani mentioned the Apple app, but this is another place. NeedyMeds.org and MedlinePlus.gov. They also have in another language as well, information. Almost there. What I do want to mention is for you all to, we said we want you to be smart and be empowered and have this information, but I also want you to not be shy about sharing your concerns with your doctors. Let them know your concerns. If something's difficult for you to keep up with at home, let them know. And be candid about it. I missed a couple doses, or I keep forgetting to take my doses. Why are you sharing that information? You're sharing that information so that your prescriber can make a sound decision on what's best for you, because there may be some simpler alternatives out there for you. They're not, it's not for you to feel like I need to be a perfect person and let them know I'm doing everything. So I'm not going to tell them the truth about my medicine when you follow up and say, well, you prescribed this medicine for me, and yes, I took it all, but if it's, or I'm taking it every day, if it's something that's difficult for you, share it with them, because they may be able to find a more simpler regimen for you, or combine some regimens or some 2-in-1 tablets and things like that. So I want you to always be honest, and if it's something you can't afford, share with them as well, because they may be able to find cheaper alternatives for you. Keep a list of your medications, be it in your electronic device or paper, so that everyone knows what you're taking, and keep that list updated on a routine basis. If a product says to throw the product away after a certain expiration date, go ahead and do that, because the medication may not be effective after the expiration date. Go through your medicines and check those. Don't keep around old medicine. It's not safe. Have you ever seen one of these? All right. Looks like an expensive toy from toddler. But this is something that you can use. It's a pill box. There are several ones out there on Amazon or in the stores that you can keep. How do you keep track? This one is for multiple times of the day, for people who have to take something 4 times a day, but they also have them singular. Or there's some tracking apps if you're savvy electronically, or you can have Alexa or whatever virtual assistant you use to remind you to take your medications. But there's all sorts of things out there, but you want to make sure you're keeping track so that you don't overdose or underdose yourself, so that you can see the benefits from your medication regimen. And try and take it the same time every day. So associate that with something routine. If you get up every day and you brush your teeth and didn't have your breakfast, then try and take it the same, that same day, time of day each day. There's also ways that your pharmacy provider can help you Amazon will package your pills like this example for you if that's helpful, if you're forgetful. Or your pharmacy can synchronize your refills. You can ask about things like that. And then lastly, I just want to say, if you're ever in a hospital or if you ever go to your doctor's office, they may give you a summary of some changes of start taking this medicine, change how you take this medicine, stop, pay attention to those after visit summaries or they summarize what happened in the visit. If they change your medicines around, go ahead and read that and ask questions about that, because they may have been changing your medication regimen around and you didn't really realize it. And if you're having a hard time and you don't have anyone to help you, your health plan, you can reach out to them because they have member services who can help you keep up with your medications and point you in the right directions. They also have ways where they can help you keep up with your regimens. So that's pretty much it. I was trying to stay within time, and these are the references, but we mentioned them. And that is it. I want to thank you both for participating and interacting and giving me, sharing your evening with me. Yeah. You have any additional questions?
Nope.
Okay. Thank you, Sean. Is it Sean or Sean?
Shan.
Shan. Thank you, Shan. Sienna, thank you very much. I hope you gained something from it. Thank you, Jamie and UCF Card, for this opportunity.